So this is a very interesting area of Chinese medicine because it's a kind of unique aspect to Chinese medicine. And there's two aspects to the tongue diagnosis. One is the body of the tongue, and the other one is the coating of the tongue. So what the tongue's showing you on the body is the body of your organs in terms of, like, is the body of your tongue more red than normal? Is it more pale than normal? We're looking at, is the body shape different? Is it cracked? Is it discolored in some way? Now, tongue diagnosis can be really interesting for lay people or to patients because they can actually see their tongue in the mirror and they can look at it and they can see different changes that happen on it.
I've been spending way too long checking my tongue in the mirror.
It's harder to check your pulse as a layperson. You've no idea what you're feeling, how you're pressing too hard, what is a wiry, what is a slippery. We don't know. You don't know what it is, right? It's very hard to kind of do that and see, oh, is my pulse changing? Pulse diagnosis takes practitioners years and years to learn. It's not like a patient can kind of go home and feel their pulse and go, oh yeah, I can feel something different. So tongue, you can get a general understanding for yourself of your own tongue. So the thing you want to look out for in terms of what's probably the most significant for you is more the coating of the tongue than the body of the tongue. And the reason for this is the coating of your tongue changes day to day, whereas the body of your tongue can take a long time to change. And that's one of the reasons why I don't use it in clinic that often, because the clinical relevance of that information is we don't know where that sits. We don't know if that problem is a recent thing or if that problem is something that's something that's happened that's gone on in the past, but it's no longer a relevant thing. Whereas the pulse kind of trumps the tongue in that sense. It's going to show you exactly what's relevant at the time. So the tongue body, sometimes you'll notice like what we call tooth marks or scallops or teeth prints on the side of the tongue. And what's happening is the body of the tongue itself is growing too big for the mouth, a little bit too big. And the person bites down on the side of the tongue, and that's what's giving them the teeth prints or the tooth marks. And so the scallops or the tooth marks on the side of the tongue can often indicate dampness or spleen qi deficiency. That would be commonly the diagnosis of those things, or lead you to that. It would be part of the evidence for that diagnosis. So we don't just see tooth marks on the tongue and say, oh, you must have this disharmony. You need to have a few different symptoms, and it would be based on the symptoms that you have that need to match up to that, not just one thing on the tongue or one thing in the pulse. And then the coating of your tongue represents the dirty dregs of digestion. So your stomach and your spleen work together to digest the food, right? Now the spleen is the energy, the digestive energy of your body, not so much your spleen, your physical spleen organ. But what's happening is that the clear yang or the pure yang of the digestion, the essence, kind of rises upwards. And naturally there should be like a thin, slightly white, almost clear coating. So the tongue coating shouldn't be peeled or dry. It should have some moisture on there. So the practitioner's looking at the moisture in terms of, is it very dry and there's not enough moisture, or is it super moist and there's so much moisture this person's got a lot of dampness? Or is the tongue coating thick and greasy and yellow? That would be definitely a pathology. And that's something that you could probably notice on yourself. So if you go to an all-you-can-eat buffet and you know you have a generally pretty clean coating tongue, or especially if you have a lot of alcohol or a lot of very rich, greasy kinds of foods. So the tongue coating represents the dirty dregs of digestion. And so if there aren't any dirty dregs, there won't be a thick, greasy tongue coating. But yeah, if you eat a lot of greasy foods, like you go to an all-you-can-eat buffet, especially if you eat like a lot of cheese, cream, dairy, that kind of stuff, or beer, wheat-based alcohol, that often causes it. And the person wakes up in the morning and thinks, oh, my mouth feels so furry and I've got this horrible, disgusting, thick, greasy tongue coating. Well, that's what it is. That's dampness. So that's something that, especially if it gets very yellow coated, then we kind of sometimes feel something in people's pulses and then check on their tongue for that. But the style of Chinese medicine I use, we don't use the tongue so often because it's very confusing between the two. What's the most prominent thing? The pulse is kind of more important to us than the tongue. But there's plenty of practitioners that use tongue diagnosis. And the different aspects on the tongue, like there's different regions similar to a little map of your body. So particularly if you notice the tip of your tongue is very red compared to the rest of the tongue. That's a very common thing with it means that there's heat in the upper part of the body, so this part here, and there sometimes could be like the heart, the Chinese medicine heart, which is your mind, your mental health, could be getting harassed, and that could be, you could be mentally restless or something like that, have some mental health problems, have some anxiety, or some insomnia, some sleep problems. That's very common with that little red tip of the thing of the tongue. And the shape of the tongue can mean lots of different things. But again, it's not an independent thing where, okay, you've got a red tip of your tongue, so you must have anxiety. It's not like that. So please don't jump to any conclusions. If you notice that you've got something on your tongue, then the best thing for you to do is go to your Chinese medicine practitioner and ask them about it, and they'll be able to explain, because there's sometimes multiple reasons why that could be, and you need more than one aspect to make a diagnosis often. A few signs and symptoms. So the tongue is a sign, like we can see it, so it's a sign. Now, again, different styles of Chinese medicine utilize different methods more than others. So some practitioners may be really, really interested in your tongue, and others may not be as interested in your tongue. Now, if you're a patient of mine, you probably think, Marie, you've never even looked at my tongue. I don't use tongue diagnosis very often. I always use pulse diagnosis, but I don't use tongue that often. I do use it sometimes, but not often. But there's plenty of practitioners that use tongue diagnosis all the time, and as a stock standard of what they do. Good. Okay, so hopefully this video has been useful and informative for you. It's my pleasure to have you on the channel today. And if you haven't clicked subscribe already, click the subscribe button below. That way you're going to be part of the team that hits 1,000 subscribers by the end of this year, and that way you'll never miss an episode, you'll never miss the great content that I'm putting out. Thanks for staying to the end. If you've got comments, questions, feel free to put those down in the videos. That'd be great. I'd love to hear from you.